Right.
Hi, Dr. Ritchie.
Hey, how are you doing?
I'm good. How are you?
I'm doing fine, thank you.
Good. I just got an email from Brooke saying that you'll be a few minutes late, so no, just saw
Yeah,
the email.
I'm glad to be here.
Taking a little break, okay?
No, not a break, just working.
Working. All right. So I can see you clearly from your end.
Okay.
Just when I talk, you'll probably see on your screen there's a little head thing that pops up because my camera is not on.
Okay.
And when you talk, it'll show your screen.
Okay.
Okay. All right. So it won't take that much of time. What I'll do is just do a little introduction to you and introduce you to the DCA TV. And if you want to say thank you or whatever, you can say that. And
Okay.
I think you already have the questions, right, on holistic dentistry and cosmetic dentistry.
You're gonna ask me the questions.
Yes. So
Okay.
yeah, holistic dentistry. There is about 4 questions, and cosmetic same.
Right.
So what I'll do is I'll just ask you the questions, and you can answer it, like keep it to like maybe a minute and a half, whatever you think.
Okay.
And we'll do the straight recording with the 2 topics. When we do the cosmetic one, I'll just do a little intro again and start with the question. And when the final video is done, we'll take out all the stuff that we're talking about.
All right.
Okay. Shall we start then, Dr. Virtue?
Go ahead.
All right. Okay. Hello and welcome to DCA TV. I'm your host, Salika J, and I'm here with Dr. Virtue, dentist at Virtue Dental Care. Dr. Virtue has dedicated his professional career to provide patients with the best of what dentistry has to offer, with the highest standards of health and safety. Dr. Virtue practices mercury-safe biocompatible dentistry in accordance with the highest standards of health and safety as outlined by the International Academy of Oral Medicine and Toxicology, which he is also the president, the leading association of dental professionals committed to biocompatible dental practices. We are delighted to speak to him today, which will give us a clear idea of some of the common dental procedures. Welcome, Dr. Virtue, to DCA TV, and thank you for being with us today.
Well, thank you for the opportunity to speak to you.
All right. Today, Dr. Virtue will enlighten on some of the common questions you may have for holistic dentistry. Dr. Virtue, can you tell us what is holistic dentistry?
Well, holistic dentistry is dentistry that takes the whole body into mind. In the past, and still to present, dentistry is usually the dentist looks at the tooth and decides the best thing for that particular tooth for whatever the application is. Holistic dentistry is going to take in the fact of the immune system and the health of the patient so that we select materials that are more biocompatible for the patient. In other words, we're always trying to optimize the immune system. Now, I'm the past president of the International Academy of Oral Medicine and Toxicology, and also teach this material to dentists who want to learn how to become more biocompatible.
Okay. How is holistic dentistry different?
Well, holistic dentistry is different in the sense that we actually can do a biocompatibility study. It's a blood test that can be done that we can choose materials. There's probably 6,000 different materials in this booklet. But a booklet comes back and we can actually choose what bonding materials we use, what tooth colored fillings we use, what crown we might have to use, or whatever dental procedure we're doing. We can check through this book and find out what's compatible with that patient.
Okay.
Now, it's called a Clifford test, and
Dentistry.
it's easily done. We do it all the time. We don't do it, but the patients do it with their physician.
Okay. Who chooses holistic dentistry?
Well, that's an interesting question because dentistry seems to be divided more or less between aesthetic dentistry and holistic dentistry. And the folks that we find that come in more interested in holistic or biocompatible dentistry come in from the internet. People who are more interested in aesthetic dentistry come in from a different avenue. But what I found over the years is the people who were interested in holistic dentistry are very, very knowledgeable about that subject. And when I lecture to my students to teach this, I tell them, look, you got to know what you're talking about, because these patients will come in and they'll know more than you do about this. So you really need to bone up and study and be doing the right thing.
Okay, sounds good. How does holistic dentistry go beyond ordinary dentistry?
Well, as I said, it takes a biocompatible issue into effect. We're not just trying to fix the tooth. We're trying to fix the patient. And people a lot of times don't realize you stick something in the mouth, you're sticking it in the body. Now, what that means also is that we never use mercury fillings. Haven't used mercury filling in 20 years. And if patients look back into their mouth and they see what's commonly called silver fillings or amalgam, they're 50% mercury, so I call them mercury fillings. But what a holistic dentist is going to do is more safely remove those mercury fillings by using special suction equipment, by using oxygen supply, vinyl dams, and ionizers in the rooms. In our basement, we have a mercury collection system that collects 99% of the mercury that comes out of the patient's mouth. Because realize that in most dental offices, all that mercury goes right into the septic system. It's estimated that 40% of the mercury in streams and rivers comes from dental offices, but a biocompatible dentist will have a separator in his basement, will take that material out so it doesn't get into our streams and rivers. And then that's, of course, recycled with a certified recycler of heavy waste like that.
Okay. So now we're done the questions, Dr. Virtue, for holistic dentistry. So we're good with that. I'll do a small introduction into cosmetic dentistry, and we'll just run through the questions, the same thing we did before.
Okay.
Okay. Today, Dr. Virtue will enlighten on some of the common questions you may have for cosmetic dentistry. Dr. Virtue, can you tell us what is cosmetic dentistry?
Well, cosmetic dentistry, a lot of times in patients' mind, is the pre-smile, the 6 front teeth they're looking at. And obviously, we want everything we do to be cosmetic. In our practice, in any biological dental practice, we're not going to use any metals if we don't have to. So everything we put in the front of the mouth or in the back of the mouth, we want it to be beautiful, and we want it to look like a tooth. In other words, if we restore a posterior tooth or a tooth in the back of the mouth, when I'm done, I want that tooth to look like it did when you were 6, 8 years old, instead of showing metal or anything tarnished or not tooth colored, you might say.
Okay. Who is a good candidate for cosmetic dentistry?
Well, anybody really is a good candidate. If you're concerned about biocompatible dentistry, that's a good candidate. Anybody with missing or crooked teeth, stained teeth, anybody with a whole lot of fillings in their front teeth that have stained or yellowed over the years, that's an excellent opportunity to do cosmetic dentistry. And as we get older, our teeth wear. We have these 7 days a week and 365 days. We use them 24 hours a day, and teeth wear, and we don't have anything. Cars don't last that long. So as we get older, our teeth wear and they crack and they break, and that's where we're able to come in, cosmetically restore these teeth.
All right. When it comes to cosmetic, is cosmetic dentistry worth the time and the cost?
Is it worth the time and the cost? Is that your question?
Yes, I'll repeat the question.
Well, that would be a question for the patient to answer. I certainly think it is, but everybody comes in the office with a different goal, and we try to find out what that goal is, what the patient's interested in accomplishing. That's the question we ask. And if it's aesthetic dentistry, then we can focus on that. Some people just come in and say, look, I just want, if it's broken or decayed, I want it fixed. Some people don't care what their smile looks like, but more and more people are more conscious about the aesthetics and want to look more youthful and have the teeth looking like they did maybe 40 years ago.
Okay. My new smile last after getting cosmetic dentistry.
Do they smile a lot? I hope so.
Sorry, the question was, how long will my new smile last?
Oh, I'm sorry. Oh, your new smile will last for years. I've got patients that I put veneers on 20 years ago, and they look great. It is a little bit dependent on how well the patient cares for it too. If you're a grinder or a bruxer, you clench your teeth and rub them at night, you need a night guard. Those kind of people broke their original teeth, and they can break veneers or crowns. But with proper care, aesthetic dentistry can last 20, 30 years without a problem.
Okay, all right. So, Dr. Virtue, those questions were answered really informative to me, and I think I'm pretty sure when the video's done, it'll be great.
Okay.
So that those are all the questions. So what I'll do is I'll give this video to my edits team, and we should have it together between 1 to 2 weeks. We'll send it to you to have a look at it just to get your approval before we upload it to the site.
Great.
And you can use it as well for your website, on your social media, whichever you would prefer. So thank you so much for your time, Dr. Virtue, and for being with us today. It was a pleasure.
Well, thank you. I appreciate it.
Okay.
Bye-bye.
Have a great day.
You too.
Bye.
Bye-bye.
I'm just going to do one more question and repeat it. It's called, is cosmetic dentistry worth the time and the cost? And I'm also going to do the introduction just so we have everything clear. Hello and welcome to DCA TV. I'm your host, Salika J, and I'm here today with Dr. William Virtue, dentist at Virtual Dental Care. Dr. Virtue has dedicated his professional career to provide patients with the best of what dentistry has to offer, with the highest standards of health and safety. Dr. Virtue practices mercury-safe, biocompatible dentistry in accordance with the highest standards of health and safety as outlined by the International Academy of Oral Medicine and Toxicology, which he is also the president. The leading association of dental professionals committed to biocompatible dental practices. We're delighted to speak to him today on a few topics, which will give us a clear idea of some of the common dental procedures. Welcome, Dr. Virtue, to DCA TV, and thank you for being on the show today.